Good evening, friends. Today is 17th September. Today we are going to cover two important articles from the Hindu. The first article is related to the GST 2.0. The article is very important where a number of implications of this GST are highlighted in this article and what should government do for the long terms, because these GST2 reforms are for temporary relief only, and these reforms were brought mainly due to the tariff imposed by the US on the Indian government or Indian economy. So for the writer has suggested some long term reforms, because this GST 2.0 are some short term reforms. Writer wants some changes and expected some changes for long terms. Another important article we are going to see is regarding the mental health, especially the health regarding the patients, because Patients Day is observed today, and what challenges the hospitals or the government is facing, and what the patients is expecting from the hospitals or government, that we are going to see in these articles. So friends, let's start with the first article, that is the short term pain, possible long term gain. So a context of the article is that the GST was introduced in India with the view of promoting consumption and production efficiency with a tax system that was destination based. This was the definition for the GST, and currently this is in news because some changes are made by the finance minister in the GST reforms. So what are the some changes that made by the finance minister, where 12 and 28% have been disconnected, where 0%, 5% and 18% are continued. In addition to this, 40% demerit rate was introduced for sin goods and luxury items. These were the reforms made by the finance ministers in this current GST reforms. The reforms also highlighted some beneficiaries for some sectors, which includes textile, electronics, automobiles, health and food. On the production side, fertilizers, then agriculture machineries, renewable energy were benefited. So these were the reforms made by in the GST 2.0. So what are the implications of these reforms? We'll see some short terms, also for long terms. First, regarding the revenue implications, or what are the implications or what are the effect of these reforms on the revenue. The lowering the rates, due to the lowering of rate, the people will start, the demand of the good will increase, because due to these reforms people may have some extra money through which they will spend on some good, purchasing good, and the demand of these goods will increase. This is the one first revenue implication. On government side of view, the government may have loss for some revenue for long term. The finance minister has estimated around 48,000 crore financial loss due to these reforms. These are the revenue implications due to the reforms. Writer has also mentioned some revenue augmentation effect. Means what do you mean by augmentation reforms? Means, for example, when GST on essential goods like basic goods are reduced, people will have more money to spend. And what these people will do, this they will use this extra money to buy more expensive more expensive goods. This is called income augmentations, which the writer does not want to do this, because this money should be used for long-term investments. Another on the macro level implications. Macro means for long term, means on broader concept. First is that government of India's budgeted fiscal deficit for the year of 2025 and 26 will may come under pressures, because as we have seen that the quarter 1 GDP growth is estimated as 8.8%, which was targeted in annual budget around 10%. These repercussions are now going to see due to these reforms. Next is the government will not have any options or may reduce the expenditure on important projects. This is seen as something negative for the growth. For example, due to these reforms or in the annual budget, what was planned, for example, any big project was planned, that may be halted due to these reforms, where the government will try to compensate this money. Second is that increased fiscal deficit may lead to inflation or borrowing pressure on the government. So these reforms are seen as some shortcut by the government and pressure due to the tariff of US on India government. And the writer wanted the government should think for the long-term growth, which will help for or which will make more saving investment, and that will help to reduce the fiscal deficit. So in the conclusion, the writer says that GST reforms simplifies the tax structure and bring benefit to the consumers. However, the short-term revenue loss may risk a higher deficit and may create pressure on the growth. For this long-term growth, we have to think on investment, saving and improvement. These are the points that we have covered, and the writer has suggested some good measures that needed to be implemented. So let's move to the next article. The article is related to making patients' health safe. World Patient Day or the Safety Day was observed, and the theme was safe care for every newborn and every child. That is keep in mind the word is World Patient Safety Day. Okay. See, How the globally and in context of India the patients are observed. Globally, around 1 to 10%, around in 1 to 10%, from the number 1 to 10, 1% is suffer, 1 patient is suffering from hospitalization. For India, where we are facing many challenges from the chronic diseases like cancer, diabetes, heart disease, mental health. To protect this patient's health, we are facing number of challenges. And these are due to number of lapses in our systems. The patient harms may be seen as, and what the patient harms, what are the patient's harms we see? One is the first is the complex situation, that is the patient's condition is due to, first is the complex situation where hospitals are blood clots, unsafe and unsafe injections are used. Second is the unsafe condition for unsafe condition of the patient is that delay of diagnosis, where the patients are delayed for the treatment. So where the responsibility of the patient safety lies? The patient safety cannot be completely depend on doctors and nurses. It depends on families and also with the patients, because we need our health checkup continuously. We need to ask our questions regularly, means asking the questions regarding our health. Then we need to avoid our self medications. Then also we need to report adverse drug reactions, where we can reduce these health related problems. This was some related to the patients. Now beyond this, the writer has highlighted some healthcare system challenges in India. We will mention some points, or writer has mentioned for some points. First, challenges in health sectors. First is the extreme overload on doctors, also on nurses and staffs. This is one of the challenge that we are facing. Then next is the long shifts, then inadequate staffs is also one of the biggest challenge we are facing. Third is the overtime of the doctors, then fatigue, then limited time to speak with this patient, understanding his diseases. These are the another challenge we are facing. For this, the writer is expecting some regulation audit, staff training and infection control awareness among the society. In addition to this, some steps government have also taken, like National Patient Safety Implication Framework, that is 2018 to 2025. Some frameworks were given which prepare roadmap from adverse event reporting to embedding safety in clinical program. Another measure taken by the government is Society of Pharmacovigilance in India, that this society monitors and reports adverse drugs reaction nationwidely. Another step government has taken, that is the NABH, that is the National Accreditation Board for Hospital and Healthcare Providers. This bench for safety for audits on infection control and patients' right, also for medical management. These are some measures that government has taken, but Another important factors that in society that will play important role in our health sector are first is the media. How this media can highlight both the failures and success of our safety models. Second important role is of higher education institutions. How building safety awareness early only. And third important role is regarding the corporates. How that by extending the CSR, that is the corporate social responsibility, and extend workplace programs or medical awareness programs like this by the corporates. Also, added one point is regarding the technology innovations. These technology innovations play very important role during the COVID that we have seen, where number of R&D was research and development were done for the vaccination. So writer wants same in the health sector on the broader concepts. So looking ahead, the government must focus on mobilizing resources. Government must also focus on incorporating patient safety into medical and nursing educations. Third, hospitals should meet the global standard and should technology driven. These are the important solutions given by the writer in the article. Two important articles are covered. Thank you very much.